Good morning, Catherine.
Hi, Courtney. How are you today?
I'm good. How are you?
Good. It's good to be with you.
It's been a while since we've been able to sit down. Well, it's been a while since we've recorded a conversation together, but it hasn't actually been that long since I've spoken with you. That was just last week.
No.
So I'm excited to talk to you more today about what's happening in the world of physician liaisons and PRM, what you're seeing in the referral market right now, and how you're seeing hospitals and health systems create more wins in terms of increasing patient growth. And you're kind of the person to go to for this topic. I mean, you have really established yourself as a leader in this space, and dare I say, the queen of PRM is here joining us today.
That's funny. I appreciate that.
Well, I think you just have so much knowledge, and one of the questions that I hear a lot, and I'm sure you do as well, relates to budgeting. So I think it's a good place for us to kick off. Health systems are under more financial pressure than ever before. What are you seeing in the organizations that get strategy wrong when it comes to revenue growth?
Courtney, thanks for the question. I would start by saying it's truly the time to the growth strategies. That's the problem inside health systems. Health systems, of course, are so focused on, and they should be, delivering quality patient care. But, that's always the top priority. But underneath that, it's driving new revenue to ensure that they can continue to deliver that quality patient care, that they can staff with providers, nurses, the technology, the research. So the engine that needs to do that, of course, is the business advancement and making sure that the right strategies are in place for the top service lines to continue to grow, to understand what the competitive market looks like and where the greatest opportunities are to attack the market and drive in the new revenue. And where I lean in to this topic is always around time to actionable insights. And that leans into the data and how our organizations, what are they doing to develop their strategies, and what kind of data are they using? What does their process look like? Do they have outside data vendors, software, technology? What does their business strategy function look like? So for me, the approach has always been, looking at the internal data. So the EHR, how are they using the data that's captured in the electronic medical records? Are they accurately capturing the referral information? So who's referring to what specialists, and looking at their own network around their PCPs, where are they referring those specialty referrals? Are they staying in network, or is there a lot of out migration happening? So what are they capturing in their EMR? Do they have claims data that they're using to overlay with some of that EHR information? And then, of course, do they have a strong, sophisticated physician relationship management system and a provider relations team? And when I say a strong and sophisticated, I mean, are there physician liaisons going out to those referral sources and capturing all of the data? So having conversations to understand, why are their PCPs referring outside of network to specialists? Who are their competitors? So a strong physician relations team is key, and then capturing the right information. So those physician liaisons are out there asking the right questions, documenting the information that they are hearing, understanding where the outmigration is happening. All that should be, they should input that information into a physician relationship management tool. And then that data can be merged or overlaid with the information out of the EMRs, and of course, wrapping it with claims data. And all of that together, the data analysts, if an organization is fortunate enough to have strong data analysts on staff, to pull that information together, to develop those service line strategies, and then to take those strategies, put them into a plan, boil out the tactics, and execute in the market.
So what's interesting is you talk a lot about data, and that was one of the questions that I had for you today. All of this data exists. It's not, a lot of it exists within their own system of record. And they have access to a lot of external data as well, but there are many hospitals and health systems who don't seem to be using that data for their own success. With those health systems having access to more data than ever before, why do so many of them make their decisions based on their gut? Like their gut feel is what drives a lot of their decision making.
Yeah, I would say their gut feel, and also where the greatest priorities are, right? So oftentimes, I mean, when I was inside Geisinger, and this was, years ago, those big 5 service line leaders, they were the ones that usually the organization started with in terms of developing strategy. And that's because they drive in the most revenue. So it makes sense. I think where everything falls down, again, if they're 100% C-suite's 100% focused on clinical excellence, which they should be, but to have the right talent inside organizations who really understand data, how to pull it apart, understand what data sets are the most important to develop these business advancement strategies. It's not something that everyone can do and do quickly. So I think it comes from, the ability to have the right resources in place. And, if you think about it, there's not any, besides going to conferences, it's not a specialty that, you would think about truly in healthcare. So it's having those right resources who understand the data and being able to get to the information quickly and decipher it, pull it apart, and making sure that the strategies that they're putting together are comprehensive so that the data sets that they're using are the right data sets. And sometimes organizations get it wrong just because of, the lack of understanding, the lack of know-how. And there's different solutions out on the market that have half of the data sets that organizations need. The other problem right now is the lag time for data to be refreshed. Some claims data can be 18 months in arrears, and that's, between 18 and 12 months is pretty much the standard out there. We're fortunate enough that ours is 90 days in arrears, but, a lot can happen in 12 months. And so some organizations are using data that's outdated to make big moves and to develop their business advancement plans, only to find that, they're 6 months late, right? Because the competition has already filled the gap in the market, filled the need in the market, where they may have thought they needed to put an outreach clinic or outreach services. By the time organizations get around to developing the plan, the competition's already there. So
There.
speed is the key.
What I find so interesting about this whole concept is that it does seem to create kind of a blind spot for hospitals and health systems in understanding their market. Do you think that most of these leaders know that they have these blind spots, or do you think that they just aren't aware that they exist?
I think that the C-suite is getting there. They're starting to understand that, there is a level of the service line level and the leadership responsible for performance. They certainly understand, what their goals are, what the need is, what the P&L. However, make it the function inside of an organization that once they identify the need and what the strategy should be, the time it takes to execute and those resources, I believe sometimes that's what is that engine is not what it should be. When I was working inside Geisinger, I understood that the fastest way to drive new revenue and to work with new specialists to get them ramped up to meet their performance goals was through the work of the physician relations team. And that was back in, from 2005 to 2014. And we were early at Geisinger, doing that, understanding the strategic need of a sophisticated physician relations team. And we were able to build one, and working in tandem with the leadership of the strategy and planning group at the time. We worked together collaboratively to understand, okay, here's what the growth opportunities are in the market, or the goals were being set by, Glenn Steele, the CEO, and his executive team. And then we would be the ones to make it happen. And historically, it was all consumer marketing, branding. But in 2005, 2006, we pivoted and built a sophisticated physician relations team, and invested in that strategy and that approach to really understand, it's really, I talked about it earlier, it's the third piece of understanding what's going on in the market, having those physician liaisons out, having conversations with referral sources, both in network and out. That information is critical.
So when we talk about the cost of all of this, the cost of not understanding the data, the cost of fragmented systems, what health systems and hospitals may not know that there is such a huge cost associated with it. What do you think that cost is? And how do you explain that to a leader that might just not be aware of the full scope of the cost of not having a cohesive system that ties all of this information together and makes it actionable?
The cost is, are you going to be number one in the market? Are you going to hit your revenue goals? Are you going to
You
be
are
able to
speaking right to the ego of the physician leaders right now, and I love it.
Yeah. Are you going to be able to, continue to hire the physicians and providers that you need to execute the mission of your organization? That's the cost. If you don't have everything that you need to build a sophisticated business advancement machine. And that includes the right data, the understanding and capturing the right information in your EMR, and truly understanding and investing in a physician relations team and that function. And yes, is marketing, the traditional marketing, consumer marketing and branding is important, absolutely. But again, I go back to my statement earlier, the fastest way to drive new revenue is through the work of a physician relations team, a sophisticated physician relations team, taking those providers out in the market, building those referral relationships, those critical referral relationships that you must have in place, understanding who are your loyalists, the splitters in the market. So those physicians who are sending to you and to your competitor, understanding why that's happening and going and changing those referral patterns.
So when we talk about physician liaison team, and the world of the physician liaison, I think that's changed pretty drastically. When you talk about traditional marketing versus modern marketing, traditional selling versus modern selling, what really stands out to me is that this world has shifted significantly with the change in technology. Can you talk a little bit about how that role has changed over the last 5 years and what you see for it in the future?
Sure. So I'll talk a little bit about when I was running the physician relations function at Geisinger, we, under Dr. Steele as CEO, ROI, we had to pay for, of course, our budget every year. And so being able to correlate the direct impact that a physician relations team is having on the bottom line is so important. The difference between 5 years ago and today is having a sophisticated PRM, a physician relationship management tool, at your fingertips that has a national claims set, data set baked into it. So the claims are there to understand what's happening in the market. And then your physician liaison team is inputting all the information that they're gathering in real time. So, and then that also combined with the provider performance information that you can pull out of an EMR and upload into the PRM. So you have all three of those data sets working together to absolutely identify the greatest opportunities to be able to track the impact that the physician relations team is doing and track the new provider ramp up, to put ROI and dollar figures around all of that is should be top of mind. And that is the biggest difference right now as opposed to 5 years ago, because the PRMs from 5 years ago were disjointed. They're basically just a shell that organizations had to spend hours and hours in resource time to input and load with different data sets. There are products on the market like Doctivity that have everything ready to go. And what used to take 6 months to get to a business advancement strategy, now with a couple keystrokes, 6 seconds.
That's amazing. I think that's probably, as the technology continues to change, I think that those strategies will continue to get better and better and more effective to solve one of the biggest problems that healthcare systems are seeing today, which is out-migration. Can you share a little bit more about about out-migration and what you're seeing in the market, it's still one of the hardest problems to solve, and one of the most talked about problems for health systems. Yet it still kind of hangs out there as this really complex problem that many struggle to fix.
So it's pretty much everything we've been talking about. You have to have the right technology in place to be able to identify where the outmigration is happening. And then it's goes back to, good old fashioned having those conversations with your PCPs, with your internal med docs, who it's easy to, with the right technology and the right data, it's very easy to identify who is sending the business out of network, right? And some of these referrals, whether it's orthopedics, cardiovascular surgery, transplant surgery, I mean, that's big money leaving an organization. I mean, we do use cases all the time where 8 million, 12 million, 15 million. If we identify with one of our clients, 150 million in outmigration was happening. It's insane.
That's incredible.
So once you have identified, and sometimes it's just having conversations with these providers to understand why. It could be that the specialists who within network are, they don't have access, or it could just be a simple fix. But it's the speed in which you identify where the outmigration is happening, and then putting a plan in place to quickly remedy it. And when I was inside Geisinger, Dr. Howard Grant was the chief medical officer, and he and I would go meet with different PCPs who were consistently sending business out of network, and just sitting down and having a conversation to understand why. And sometimes we found it was an easy fix, but those are the real tactics that need to be happening. And I know that at the top of the organizations, everybody's so busy focusing on, again, delivering quality patient care, that these strategies and tactics sometimes, take a long time to address. And it really needs to become a priority. This needs to be a top priority.
So one of the things that you've shared quite a bit about as we've been talking today is all of the things that can take a health system from good to great, to be the best. And if someone's listening to our conversation and is really hoping to be the best, they want to move up in the market, they want to own more market share, what is the number one piece of advice you would give them?
Take an inventory of what data sets you have. Look at the technology that you're using, the software that you're using, making sure that it is delivering what you need it to deliver in a very quickly. So speed is the key. And then understanding where you're coming up short, putting budget to that, because you will make the value that investing in the right technology will deliver to your organization. You will make that investment money back very quickly. Making sure you have the right people in the right positions with the right skill sets. And, some of those decisions are really tough. Taking a good look at who you have in what positions, and making it a priority with your organization that a strong physician relations team, sophisticated physician relations team, making sure that the technology, the data are all working together.
Well, I think you've provided quite a bit of direction and quite a bit of insight on where the market's at today. I really appreciate you taking the time to chat, and I think we'll throw the Doctivity information on the screen. I think if you have never talked with Kathy or her team, you should. They are truly the experts at physician relationship management and helping your physician liaisons be more efficient, productive, and effective in their role. And they're always open to a conversation. So use that link to reach out to them and schedule some time with their team to learn more about where you might have gaps in your system and what might help you drive more revenue as we start to look forward to the second half of the year and to 2027. I can't believe those words are coming out of my mouth. And I'll also drop a link to Kathy's LinkedIn page. Please connect with her. She shares a lot of insight on LinkedIn and would love to be, I'm sure I'm speaking for you, but I'm sure you would love to be connected to anybody that's listening right now.
Absolutely. And thank you, Cortney.
Thanks, Cathryn. Talk to you soon.